Hello, I'm Dr. Ed Laskowski. I'm co-director of sports medicine at Mayo Clinic. I have a special interest in population health and wellness. I've had the privilege of serving on two President's Councils on Physical Fitness and Sports, two administrations under Presidents Bush and Obama. And our main emphasis on both of those administrations was our epidemic in this country, and really globally now, of obesity and sedentary lifestyle. It's generationally different now. If you look at data from the CDC from the 1980s to now, the incidence that each state has of obesity has risen dramatically. About 70% now of our country is overweight, obese, and exhibits sedentary lifestyles. So you can imagine the effect this is having in our healthcare economy. The increased risk of joint and musculoskeletal problems, increased risk of cardiovascular disease, type 2 diabetes, hypertension, myriad of entities associated with these factors. So we really have to make a difference in this. It's the one foundational thing we can do to make a difference in our country's health. One of the ways to make the difference is really to do something to combat that is something very simple and something everybody can do, and that's exercise. If I were to tell you there was a pill that had all the advantages of physical activity with respect to cardiovascular benefit, metabolic benefit, psychologic benefit even. Some studies show that exercise is more effective than medication in controlling depression. Even studies that are showing that exercise staves off dementia. If I were to tell you there was a pill that could do all that, that would be the best-selling pill in all of history. But there is a pill, and that pill is really exercise, but few in our country and increasingly globally are taking this medicine. You may be familiar with the initiative of the American College of Sports Medicine called Exercise is Medicine, capitalizing on that fact. And one of the things that we're finding is that physicians are really not that great at prescribing activity and really using activity as a vital sign to gauge how people are doing. This builds. There was a study done a while back in which the physician actually wrote out the exercise instead of just saying, "Oh, you should exercise." They actually wrote out an exercise plan for the patient, and these patients were 1/3 more likely to do the exercise if they had it written out and explained in that fashion. So just keeping in the forefront of our mind to remember that exercise is a vital sign for our patients, to prescribe it for them is an essential component. And for our disabled, our physically challenged population, that is extremely important. We tend to think of the able-bodied population, but people with physical disability have much the same profile, much the same risk factors, and even more because they're more affected by some of the things that can happen from the deleterious effects of obesity and sedentary lifestyle. So finding unique ways, and really with adaptive equipment, there's just about any disability can be accommodated, and we can find exercise interventions for any disability that's out there. Whether it be adaptive equipment or ways of doing the exercise, we can modify. And we need that for our patients. Today, we've controlled the effects of disease, like neurologic disease, to the point that people aren't dying from the disease anymore. They're dying with the disease in large part. So in essence, they're still dying from cardiovascular disease, which is the #1 killer in our nation still of all, both able and disabled individuals. So just to introduce the Foundation for PM&R has some wonderful resources. And for us to be physicians who can prescribe that activity to our patients with physical disability, there's some wonderful resources. One of these is a prescription pad. We talked about how important it is to write it down actually and to have our patients focus on us actually giving them a prescription for exercise. So this is one of the resources you can obtain. And if you go to the foundationforpmnr.org, you'll find a bunch of links there. Some links go to the Americans with Disabilities Fund. There's information for your patients on why exercise is good for those with physical disability and able-bodied also, and also for prescribers. What strategies do we use to most effectively prescribe exercise and integrate it into our practice. So these are great resources out there for you. Foundation for PM&R, they're readily available. Our patients need this help, and we are the ones that can give it to them and make a difference.